Your Worship, CHRA, Combined Harare Residents Association, they are here with their petition.
Their petition, okay.
Yes, I think they can start presenting the petition first.
Okay.
CHRA is up to
Yeah, I think she's a committee member from Glen View. She's also a member who also interacted with the lady who also gave birth in the toilet. So as a resident of Glen View, also she was part of the process of mobilizing petition. So she will lead the process and then I can be able to support what she will be able to say.
Okay, what is your name?
She's from Glen View, Joelin Nyachuru.
Joelina?
Joelin Nyachuru.
Oh, Joelin Nyachuru. Welcome, Joelin.
Thank you, Your Worship.
Yeah.
I'm to present the petition following the birth of a baby girl child in the toilet at Glen View Poly Clinic due to the negligence of the staff at the clinic on the 27th of September 2022. In our petition, we pray that you make mandatory policy for all the health personnel on duty to wear name tags or staff badges for easy identification and improve complaint reporting mechanism. Direct the Director of Health to publicize the patient's charter, including sharing digital posters of the charter and hanging posters of the charter at all council clinics and offices. Inform the Director of Health to effect disciplinary measures on the nurse health personnel who ill-treated Mrs. Kwaba, and if possible remove her from Glen View Poly Clinic and take responsible for any damages and costs incurred during giving birth caused by negligence by their health personnel. Increase the budget allocation and fiscal commitment towards the maternal health care provision in the 2023 council budget and make the maternal health a priority in the year 2023. Put maternal health provision to the agenda of the upcoming full council meeting or call for a special council meeting to discuss the status of maternal health care provision in the city and come up with recommendations. Finally, set up the investigations committee in terms of Section 100 of the Urban Council Act 29.15 on the status of maternal health provision in the city of Harare, considering the continued reports of negligence, corruption, and poor maternal provision in council centers across the city. May I hand over my petition to you, sir?
Yeah, you can come. Thank you very much. Move so fast.
Yes.
Wait, and that we can take a picture.
Thank you.
This one also.
Okay, thank you very much. Okay, so with me here I have Matron Kaseke and the administrator. Matron Kaseke, you're overall in charge. She's overall in charge of our nurses and our council clinics. So she's overall in charge. So she superintends this. The doctors and others who are there have gone to a meeting which was scheduled. But we thought that this was very important for us to be able to receive this petition. And I want to thank my sister. What was the name again? My sister Joelin for the effort and the articulation of the issues in your petition. And I see the signatures. The procedure is that most definitely we will take it to council. It will be discussed in full council. If need be, the issues need to be exhausted. A special council can always be called, so we don't have any issues around that. We do believe that in the main, we do have how many beds per month for all our clinics?
For all our clinics, we have around about 2,000 beds.
Yes, for all our clinics, we have around about 2,000 beds a month. That is, a lot of people come to Harare, the Harare residents, Harare citizens, so around 2,000 beds per month are done by our clinics successfully. And we are proud of that record, and we would not want to spare the whole effort that is being done by the workers, by the nurses, and a lot of them that work in very difficult conditions, but that is not an excuse, but it shows that as a city we are responsible for the large number of beds in the whole country, and we end up having the what I call is health tourism coming to Harare. So this incident, is regrettable as they may be, need to be dealt with decisively. And some of the recommendations you give are very important in dealing with that. The context we are operating in is that we have supposed to have an establishment of over 600 and something health personnel. We are only at half that level. We are only at half that level because there's a brain drain to government. Government is paying its health personnel better than us because of the US dollar component. Then also the brain drain outside the country. A lot of our health personnel have left the country. There's a massive recruitment after COVID by the health systems the world over, and that has impacted on our staffing level. A lot of our people are having to work long hours, and probably that is creating some dissonance and some drop in the quality of service. But I assure you, we are committed to issues of maternal health. We know that as the city, we are the bedrock of maternal health, if not for the whole city, for the whole country. And we are going to be expanding, improving the quality of service that people can get at our maternal clinic. As you know, some of the issues relate to issues of referrals. Sometimes we have to refer people to the main hospitals should they believe or should they see that the client is going to have difficulties. So we accept the petition, as we promised that we'll accept it personally. We have checked on the mother at Harare Hospital and the child, and I'm advised by our health practitioners and our doctors and the matron in charge that the mother and the child are in a stable condition. We will be monitoring them. We will also be taking care of their expenses at Harare Hospital as a city. I'm told that the head in charge, Dr. Chonzi, assured me that they will do that, and we will also be able to deal with any issues that have come to do that. Yes, the issue of name tags, I think it goes without saying. It's not a big problem. We don't have issues with that. The issue of a patient's charter, do we have a patient's charter? We do have a patient's charter, so our information department will put it on our social media sites. We'll also create social media handles for our health department. As you know, we are the primary care health giver for the whole city. We are also in charge of all the infectious diseases that will bedevil the city. We are also in charge predominantly of the vaccination programs of the city, and therefore we will be able to continue with those services. We will call upon the government to at least give us a grant as it is required under the Health Act, and we hope you'll assist us. They are supposed to contribute to a municipality half of the budget that it contributes. In other words, if we use 1 billion the Ministry of Health is supposed to give us 500 million. That assistance has not been coming. The last time it came, I think, was in the 1990s. And up to date, that assistance has not come. We are also wanting them to contribute to the staff costs. When you hear about vaccination programs, they predominantly are done through our clinics. Our personnel do the vaccination throughout COVID, throughout the measles thing, and any other diseases, including fumigation and so forth. Just recently, we were fumigating Barret for some parasites that were there. So we need the grant from government. That grant has not been forthcoming, and the devolution funds have not been forthcoming. So we require that we get that assistance to be able to fund our healthcare. And what has happened is that the city has grown around the city. So diseases do not know boundaries, and births do not know boundaries. So all the informal settlements and the other cities that have built around our city, like Jimba, Manyame, Chitungwiza, and so forth, Mondoro, all those people come to be treated at our clinics, yet they are not ratepayers, and we cannot throw them away, because an infectious disease, wherever it starts, it will affect everybody else. So there's a huge strain on the municipal health delivery system. Be that as it may, we try our best to continue with those services. Our maternal fatalities are within a reasonable range. I will get the full statistics. Any single loss is, of course, not accepted, but we are trying to meet the UN standards so that we don't fall short of the standards that we are required to uphold as they are given by the Ministry of Health and also best international practice. We will look at whether there was issues of negligence or discipline at the place. Our regulations require us to hear both sides. We will hear the side of the people who were remaining there, together with the testimony of the mother and the people who were accompanying the mother. That should not be a big problem. Yes, we will increase our budgetary and fiscal commitment to health. We will also try to increase our efficiency. We need to develop models. I know there are other best models that have been done. We are toying with introducing a health levy for the city, a citywide health levy, so that we are able to meet the cost. Since we are not getting much from the national fiscus, the residents might have to shoulder the bill in terms of the health requirements. We are looking at private-public partnerships with other corporates, hospitals, medical aids, and so forth, so that we increase the commitment to health. We are also looking at how we can expand and deepen the services that we can offer as a health department. But be that as it may, we are thankful and grateful to the Lord that the incident has might and is looking like it will end well. We have a bouncing baby and a safe mother. These situations can and could have turned south very well. But we are appreciative and thankful that we have welcomed an addition to the residents of Harare, albeit in difficult circumstances. But we all know that even our Savior, the Lord Jesus Christ, was born in a manger. Might not have been the best place to be born in, but these things have happened, they've been reported, and we'll make sure that it does not happen again. But we will always welcome a birth, and the birth that is healthy. In addition to paying the bills, we are going to donate to the mother. We would have gone there this afternoon, but there is a program at the hospital. I think His Excellency is opening, what do you call it? He's opening Nut Farm, a big pharmaceutical hotel So I'll give it to the matron so that they will hand over to the baby and the mother tomorrow when there's less congestion at the hospital. And then we got these donations, these things, these timely donations from Bronte Hotel. They've given bedding, pillow, bedspread. I don't know, maybe we might need to open. Yeah. You know, these days of internet, the internet people will say I lied. There was nothing in the. I mean, maybe can you assist me to open that? They will say there was nothing in the.
Waste management.
They will say it is waste management bag, but we will donate to the child. We'll make sure we also give any medical requirements. We'll pay the bills and welcome this bouncing citizen, new citizen. So this is what we got from Bronte Hotel: pillows, linen for the mother, blankets, fresh towels, a bedspread, blankets for the baby, and so forth. So we will make sure that we'll then follow up. It's all in there. There are more blankets, more, very comfortable towels, and so forth. So we will be handing over to the mother tomorrow. As I said, there is a program by His Excellency. They forgot to invite Harare 1, but I know very soon they will be calling on me. It's a big warehouse. They will be asking for water and other services that council provides, but they will soon know that the city is also run by Harare 1. But we welcome to the addition of things that are there in Harare, that big warehouse. We would have gone there, all of us, but we will defer to His Excellency's program so that we don't clutter the programs at the Harare Hospital, but we will hand over, and you can come, Madam, and also accept. I'm sure you're in touch with the mother, isn't it? Yes. Yes. So please come and accept the donations in their place and stead, so that you can make sure that they reach to the mother and the child. So you can, I don't know what we do, we hold them. Yes. So, pictures, they require us to hold these things together. So we are proceeding to hold the blankets that will be used by the baby. So thank you very much. The city is going to try and provide a health service that is got dignity. But as I mentioned earlier, we are suffering huge constraints of funding, of personnel. We require huge investment from central government through devolution funds. We require ambulances. We require to expand our polyclinics so that they become general hospitals in themselves. So we have a lot of investment. We also need to expand our maternity clinics so that they are able to meet the demand. We provide the cheapest service across town, so there is an inundation or huge traffic towards our clinics, and we cannot turn anyone away, and we will not turn anyone away. So please, this is an effort that requires all of us, your efforts. The same petition you gave me, you must also give to the Minister of Health. There is a full general there and the whole vice president, where you can also send a petition so that they can invest in our health requirements. But I thank you for the effort, and let me not take too much of your time so that these things can get to where they are supposed to get. I don't know if there are questions or what we have said is fully understood.
I want something in vernacular.
You want something in vernacular?
Yeah.
Zvaitika pano ndezvekuti maresidents eku Glen View achitungamirirwa naJoylin anova iye mugari weku Glen View vauya nepetition vachichema nekugunun'una nezvakaitika pakabarwa mwana mutoilet kuclinic yedu yematernity panozvarirwa vana kuGlen View. Tatambira zvichemo zvavo zvaita kuti tiwedzere mari kumakliniki edu, vaita kuti tinge tichiona conduct yemanesi iwawo. Tati tichavunza vese nyaya yose ine mativi maviri, ndo zvinotaura mutemo wedu. Tichavunza toona kuti zvakafamba sei uye toita sei kuti zvisaitika futi izvozvo. Tabudisavo kuti vanoda kuti vasevenzi vanosevenzera muzvipatara vange vane maname tag. Icho chikumbiro chatatambira ndina Metron Kaseke pano, vanova iye mukuru wema clinics edu ese emuguta reHarare, anova ivo akawanda. Tine how many polyclinics?
12 polyclinics.
Tine 12 polyclinics.
And 17 satellites, a total of 40 clinics.
And 17 satellites, a total of 40 clinics. Tinonge tichifanirwa kunge tine vashandi 627 or thereabouts. Asi pari zvino tinongori nevashandi 300. Vazhinji vacho vatorwa vachiindwa navo kumhiri kwemakunga, vachiinda kundosevenza ikoko. Kwaita bishi nekumhanya ikoko nenyaya yekuti vanonopuwa mari yakati one day. Vamwevo vari kumanya kunosenza kuhurumende uko kwaita nyaya yekupuwa foreign currency yatisiri kuwana isusu secity council. Saka chikumbiro chedu ndechekuti hurumende inge ichitipa imwe mari titutsire pane mari yatiri kupa vashandi vedu vari kusevenza uko. Kwasara zvipururu zvevashandi 300, isusu tichida 600. Saka inyaya yakati omei. Tine nyayawo futi yekuti tibetsere mwana azvarwa nhasi. Tamuwanira mapampa, matauro veBronte Hotel, inova hotera huru. Vatipawo machira, mapilo nemashitsi nezvimwe zvakadaro zvinoita kuti mai nemwana vange vachivata vakatambarara manheru. Iye mai nemwana vari mucondition iri kunzi iri nani. Saka tinovagamuchira muguta reHarare saresidents, chero havo vazobarwa panzvimbo isingafadzi asi iresident yakangofanana neni, yakangofanana newe. Tinomugamuchira muguta reHarare Sunshine City. Thank you.
Mayor, sei idambudziko richiramba richienderera mberi nekuti mukutanga kwegore makamboshedzwa futi secouncil kuparliament uchinzi mutsanangure kuti sei vana vachizvarirwa mumatoilet, sei vana vachizvarirwa pamagedhi akalokiwa usiku, asi imuchiisa kuti munenge muchikwanisa kunge muchitarisira vagari vavo.
Isusu tinobetsera kuzvara vana 2000 muHarare. Tisu tinobetsera nyika yose, tinobetsera maguta ese kubatsira vana vanozvarwa vazhinji. Tinozvara vana 2000 nemaresources mashomanone andataura apa. Pavana 2000 ava vanozvarwa vazhinji vacho vari kuzvarirwa muzvipatara, vari kuuya vari healthy, vari kuuya vakanaka. But mukushanda nemukufamba panoitika njodzi, panoitikawo zvamuri kutaura izvi. Isusu chinangwa chedu ndechekuti zvive zero izvozvo, but potse kana makamboita hama doctor, makamboita hama nesi, nyaya dzekuzvara dziri complicated. Pamwe pacho unoti rega ndinde ndinozvibetsera kuchimbuzi pobuda ari mwana, pamwe pacho unoti regerai ndiinde pakati pobuda pari mwana. Nyaya iye murume uchitodhiraivha chaiko kuenda kuchipatara, mwana wake anogona kuzvarirwa mumota. Saka isusu hatingadi hedu kuti tipinde mutsanangudzo, but pane avo vakambosevenza muzvipatara, vakambobarirwawo vana, vanoziva kuti kana mwana ouya anouya. And kazhinji kacho madzimai pane zvinoitika zvakati zvokutoti pane mumwe munhu anogona kuenda kuchipatara achitofunga kuti ari kunzwa mudumbu asina kana kutomboona kuti ari kuda kubetserwa nekuzvarwa mwana. Chakakosha ndo zvatinozoita kana nyaya yakadaro yaitika. Nyaya yakadaro kana yaitika, taita zvataita izvi, tiri kubetsera mai vacho, tiri kubetsera mwana muchipatara, toita kuti vadzokere kumba vange vakadaro. Tichirangarirawo kuti iye mukuru wedu Jesu Kristu haana kunyatsozvarirwawo muhospitari, asi akatiponesa tose. Mukomana iyeyo anogona kutozouya onditsiva, mukomana here musikana, musikana iye anogona kutozouya onditsiva kuita meya ipo panapa. Saka tinotenda Mwari nokuti vapenyu, mai vapenyu, tinotivonga kuti zvichafamba zvakanaka.
Thank you.
Thank you.
Thank you, Worship.
Tiri panyaya yemapoli, speaking from experience, indanga ndichakumbira hangu kuti mumbo assessa the way staff inotreata nayo vanhu. Ndanga ndichida kuvhunza since vari pano vemapoli kuti is it system yokufanga ndikupa example yokwedu kubudiriro satellite current you find kuti vanhu vanomiswa kunze kwegate 30-45 minutes or even an hour outside the gate hamutenderi kunopinda kusvika mauya kuzopiwa instruction agate kuti mupinde. Saka I'm thinking 30-45 one hour munhu is seriously ill wakangonzi mira mazuva ano kuri kupisa ukatodarika nekombi uchienda kumaguta unotoona vakatogara outside the gate. Saka handisi kuziva kuti ndo procedure yemapoli clinic here kana kuti
Andizimato makambosinzwa wezvo unototanga kuzinzwa. So andichaita ndizvokudai. So we are also going, since to receive the petition, we are also going to call for a special council where people, and you'll be invited, where people will air out their concerns, and then we will deal with the issues in a holistic manner so that we improve the quality of service around the polyclinics. But what I want to underscore is that our staff are working in very difficult conditions. We are holding the bulk of the primary health care of the city and the nation. Harare is the gateway to the nation. Any disease that comes in more or less manifests or comes in Harare, and they are the frontline staff of preventing infectious diseases. We have done quite well on issues like COVID, issues like measles, and even this issue of having vaccinations that are required for many children. So we have worked in very difficult circumstances, and I'm very appreciative of what they do. But at the same, I will promise to deal with any issues that reduce the quality of the service that we are giving. But I want to thank you for coming. Please, we...
kuna metro tanotoda kubvunza kuti wava mutemo here kuti mudzimai ari kusununguka mwana kubva panhamba 4 zvichienda mberi havachatenderwi kusununguka pamapoli zvinova zvakakonzera kuti mwana yazozvarwa mutoireti because angarocha
ndizvo
kune policy inoti grandma to parist inoendeswa kuhospital maprotocols akaiswa because zvinenge zvizikanwa kuti kana wabara vana wakawanda zvinogona kuitika, anogona kukasika kubuda, unogona kuita macomplications, chibereko chinogona kuregera kucontracta upedzera wakubleeda nezvimwe zvakadaro. So if you look at the protocols kazhinji kacho dzinoti you can transfer. Saka I think ndo zvakaitika ndo pane zvimwe zvinenge zvichida kuzotariswa.
So I think it's wise kuti madzimai audzwika paanoenda kuskero paipa because anenge achienda kuskero paclinic ipapo ozonzi musi wekusununguka manje hazvichaiti.
No, what we will do is probably it's something that got lost in translation. What they are saying is that when you are to your 5th or 6th baby, the chances of complications are high. So when they take your details, when they profile you, what they are supposed to do is to then refer you to the central hospital. So in this process, she was being referred to the hospital. She was not being said, don't, from what I hear. Because like I said, we hear both sides. But I wouldn't want to prejudge. I've heard the side. The process is that they were supposed to transfer her to the main hospitals where they have capacity to be able to deal with any complications. So what we will do is we will, our information department will produce targeted information packs for mothers that have 5th to the 6th children so that they are ready to be referred to main hospitals which have the capacity to deal with complications. But en route to going to the main hospital, I think in nature, because then she needed to go to the toilet, and what happened then happened. But that is the version of the stories. But what we decided to do was that we cannot prejudge or look at the circumstances. We need to hear your side. We need to hear our professional side. But they have a protocol where when you get to your 5th child, you are supposed to be referred to a central hospital so that they are able to manage any complications that can then happen. So, but when it gets translated to the common man, it's as if they have said, because you have a 5th child, leave this place. It is actually a protocol meant to protect the child and the mother, so that should they profile and the information reveals that, they then are supposed to refer you to a main hospital where there are facilities to deal with any complications. But we are where we are. We are not people who like to give excuses. That is why we have taken responsibility, and we will take responsibility. It is our job to explain that protocol in a language everybody understands. Going forward, we will explain it so people will understand that they've not been rejected, but that they've been referred. We will also commit to put ambulances at our polyclinics. Every polyclinic must have a permanent ambulance, so that when we refer people, they don't have to get private cars, so that they then are taken to hospital using our own transport. So we will deal with that issue. And that is where I think it got lost in translation. It's a perfectly accepted protocol, and that is what was intended to be done. The issue was that no one said go to the toilet, or the mother was not running away to go to the toilet. That going to the toilet was a genuine belief that there was a genuine call of nature, but the call of nature was then different. Okay, thank you.
Thank you, Your Worship.